presentation is from Ukwanda, Center for Rural Health, from Amanda and Innocentia. Oh, no, she's online. Oh, excellent. Okay. So Amanda is a speech language pathologist and based in Worcester at the Ukwanda Center for Rural Health. And she's set up the first placement of speech therapy students at the Rural Clinical School. And she's also been on the HPCSA as a board member. And her colleague is Innocentia online, is a social scientist and an educator, also based at Ukwanda. And we look forward to your presentation on implementing a postgraduate rural health training needs program. Is that right? Yeah. Over to you.
Thanks. It's good afternoon. Good afternoon, everybody, and welcome to the session. Innocentia would have loved to be here, but she had. So many of you will have been involved in the discussion around postgraduate rural health programs over the years, and were involved actually in even the conceptualization of the prospective postgraduate diploma in rural medicine. So my presentation overview is just up there. We'll do the background, the key goals of Ukwanda Center for Rural Health in Worcester, at Stellenbosch University, and the Rural Clinical School, which is at the Worcester campus. Then the proposed offerings, the organizational structure, we'll go through the learning outcomes for the PGDIP and look at the PGDIP profile and explore other postgraduate diplomas or postgraduate programs, Right. So the key goals for Ukwanda Center for Rural Health in the last 5 years have included selecting and training a cohort of rural students in the Faculty of Medical Health Sciences, and to initiate the development of a rural clinical school in another geographical location, which is the Uppington campus, where we have students placed at the Dr. Harry Surtee Hospital and also working within the environment. Then to grow Ukwanda as a center of expertise in rural health research. And then my current role, which involves the development of postgraduate diplomas and degrees programs in rural health. And obviously we've all heard throughout this conference about civil society involvement, and then expand community engaged school with the inclusion of students from additional programs and faculties. So we've currently had engagements with University of the Western Cape and other health programs in other institutions. So what are our proposed offerings at this point in time? We would like to be able to offer short courses as well as webinars, postgraduate diplomas, master's programs, and a PhD in rural health. And within the Ukwanda Center for Rural Health, we have our director, everybody knows Prof. Ian Cooper over there. And then we have a management committee and the postgraduate operational team. This team was established last year when setting up the PGDIP. And the team is made up of Ukwanda staff members who deliberate on issues related to postgraduate programs. In the program itself, we have 4 modules, and those 4 modules are led by various team members and the likes of the clinical skills resource team. And I'm happy to hear the involvement with the Redasa onboarding is Dr. Hans Hendricks. And he has been involved with a team of various clinicians and academics throughout South Africa in developing the procedures and the skills within that. Then we have the major infectious disease challenges, which is led by Dr. Yankee Talyard in collaboration with some colleagues from MSF. And then the delivering healthcare in rural communities, which is led by our Mr. Cameron Reardon, and that focuses on concepts such as community-orientated primary care and interprofessional collaboration. then we have the clinical governance in district health services, which is led by our Dr. Francois Coetzee. Right. The learning outcomes for this PGDIP is that we want to provide doctors in rural district hospitals an opportunity where they will acquire the necessary knowledge, skills, and approaches for practice. And at the end of these outcomes, that the students will be able to manage a range of patients at a rural district hospital with limited specialist support. And fortunately, and maintain effective healthcare delivery and appropriate public health in participable development. Our colleagues have shared in their presentations that one of the barriers or enablers to staying within a rural environment is professional or postgraduate training and education, and hence the development of these programs. So we are launching our PGDIP. The first intake is for 2023. We have wonderful leaflets at the back. There's some in your bags. And we are encouraging everyone to share and to promote participation within this program. It is an 18 months diploma with an NQF level 8 with 120 credits. It's work integrated learning in that we expect we will be utilizing a hybrid learning teaching strategy, and we would like our students to be based within their context and to continue the training or the education. And we will be using self-directed learning, which is in line with adult learning. Then, as I've indicated, it's delivered through a hybrid learning model using synchronous and asynchronous contact through podcasts, webinars, forums, etc. Now, the modules, as I've indicated before, are the clinical skills for district hospitals, which holds most of the credits for the PGDIP in rural medicine. That holds 55 credits, and you have a year period or duration to fulfill that. And then we have the major infectious disease challenges, which include HIV, TB, and other minor infectious disease conditions, drug-induced lung infection, or as well as antibiotic stewardship. Yes. And then the delivering healthcare in rural communities is a 25 credit module, and the clinical governance in district health services is a 25 credit module. That just provides our program structure where we have the clinical skills running throughout the year, and parallel to that is the short 15 credit major infectious disease challenges module. And then in the second semester, the clinical skills runs parallel with the delivering healthcare in rural communities. And the last semester, which is in your beginning of your second year, the first semester beginning in your second year, is the clinical governance with that's running across 20 weeks. Also to note for our other healthcare professionals wondering why rural medicine only, is that we will be offering this PGDIP, elements of the PGDIP, in particular 2 modules, as short courses for all healthcare professionals, because the principles that will be presented within these modules are applicable to all healthcare professionals. And those 2 modules in specifically will be the delivering healthcare in rural communities in the second semester of 2023, so please look out for that, and the clinical governance in district health systems in the first semester of 2024. Once again, that advert that just popped out of Francois' presentation, we have no idea who said he must put it there. But again, there's been an extension on the application process. Please, if anybody needs assistance with applications, they must kindly contact me, and we will go through the application process together. Now, we have our promotional video.
Why we are offering this as a content is that we are really about making a difference. And we think by training doctors to help them be better rural practitioners, we can make a difference. Making a difference to rural communities, about trying to improve rural healthcare and the lives of people who are living in those communities.
People in rural areas will be able to get equitable healthcare and services.
The exciting thing about this diploma is that this gives you an opportunity to translate some of that intention into meaningful contribution.
The requirements for the postgraduate diploma is that you must hold an NBCHB qualification.
We really invite you to join us in this journey as we seek to make a difference to rural communities.
Started doing that kind of dancing. So that's just the information on the postgraduate diploma. But also what we are investigating is the exploring and implementation of a postgraduate rural health education program. I will just skim through this due to time, but it is about capacitating the rural health workforce towards local care. And I'm sure Dr. Reed will remember this from an article he wrote at many years ago. Yeah. So we all understand the theory behind the disparity within rural healthcare and the need to have generalists and people who understand what skills, fit for purpose skills that are required to be competent in to work in a rural environment. So we would like at the end that our students can treat any patient, any problem, anytime, anywhere, without having feeling incompetent, but also being able to access the necessary resources and information. The background just goes through the theory of the value of primary healthcare and a comprehensive healthcare system, and understanding the value of each healthcare professional in servicing a rural community. So our problem statement for this is that training for postgraduate rural healthcare professionals has been a topic of interest for researchers and scholars. And the significant body of research is mostly found in more high-income countries and very limited in terms of middle income and low income country. But there is a body of work that is emanating regarding this. But we found that there is a need to explore the educational needs of postgraduate rural healthcare professionals and to create modules that are necessary and unique to us. I won't even touch on what is rurality. At times we talk about the ultimate search for the meaning of rurality, stealing from Viktor Frankl's book title. Nonetheless, we know that it is a complex environment and it requires specific competencies. And what we then are envisaging to do is to conduct a research of what are the educational needs. Appropriate programs must be implemented to ensure that these needs are met. And by doing that, we will then be able to identify these needs, identify curricula, and explore different modes of delivery for the continuation of professional development of rural-based healthcare professionals, thus addressing this gap that has been identified. The research design will be a mixed method, and we will be conducting an inquiry and using questionnaires, questionnaire survey to determine what the needs are, as well as focus group as a second phase in terms of determining sort of going deeper into the information that has been provided. the tool that will be used is a modified Hennessy-Hicks training needs analysis that looks basically questionnaire that has that is valid, has validity and reliability, but we've also developed our own concepts that are in line with the Hennessy and Hicks survey, looking at what the needs for training are. Thank you. Okay. And then participation will be voluntary, and the survey will be sent out through a RedCap link, and colleagues will be requested to participate in the study and give us insight in terms of what they think is relevant for training. And then we will be, there'll be ethical considerations in terms of applying for ethics and ensuring that we fulfill those, and there is no risk associated with this study. And I'm working, Essentia is actually our researcher, so most of our work will be conducted in-house in collaboration together. I've shared this slide because we learned the inequality, equity. Ideally, by providing these postgraduate programs, we will also be providing justice in terms of supporting the professionals that are in distant proximity from education, but also ensuring that our patients receive adequate care and support. So at least if we can get this leg of the barriers decreased, we can then ensure that retention in the rural space. Thank you. Questions and answers. And I have team members to delegate answers to. Sorry.
So we've got a couple of minutes for questions and answers. Anybody?
Sorry,
Yeah.
Dr. Reed. When are you applying?
No, they're supposed to ask you the questions. Anybody? Yeah.
Can I speak loudly? The question is about the program. Are they all that stretch over 2 years?
Are the 4 modules spread over the 2 years or how? Yeah. No, I'm just repeating the question.
Oh, thank you. Thank you. I thought you were doing a good job, Dr. Reed. So the program is spread over 18 months. So the first year is 3 of the modules, and then the last year, the first semester of the year is the last module. Yeah. And community service doctors are eligible.
It's for the online people, otherwise I can't hear. Yeah.
Thank you. So while we are accepting doctors who are in their ComServe year, in addition to that, we welcome our clinical associates also to apply. And those applications we will consider, because unfortunately we have to go through a process with regard to the clinical associates as well.
Thank you, Lindsay.
And I'm interested that a speech language pathologist is leading a postgraduate program for doctors, which is fantastic. We're stepping up to the leadership of the postgraduate space. Yeah, Ian.
Just to say why we're doing the research is that, there was a specific strategic reason which no longer exists for starting with a diploma in rural medicine, which was around Africa health placements, and they had a particular need. So, I mean, one of our big questions is, do we have a postgrad diploma in physiotherapy, rural speech? We don't want to go there. We're thinking of, can we have a postgrad diploma in rural health where one element is clinical training in your particular field, but the rest is generic, something around that. So
Okay.
we'd be interested in feedback on that.
But you're starting with the medicine. Okay. Excellent. Thanks, guys. Great presentation. The last one, and